indicative date for the start of each phase would be kept under constant review. In the time since that plan was set out, and as we made progress through it, we have seen some very positive changes in our country. People have been able to re-establish physical contact with friends and loved ones. We're able once again to enjoy the beautiful sights and attractions available to us all across our country. A range of small businesses have been able to tentatively reopen and work to re-establish themselves. We're able to go out and enjoy a pint and a meal again. But one thing hasn't changed. This virus hasn't changed. It remains as indiscriminate in its cruelty as it has since it arrived, and it remains as relentless as ever in its effort to find new hosts so it can continue to spread. My government and I have received advice from the National Public Health Emergency Team. The concern about the rise in the number of cases over recent weeks is very real. The R number, which we have all become familiar with, has now risen above 1 in this country. And the international situation, with almost 1.5 million cases reported in just the last week, represents a growing worry. Taking these factors into consideration, today the Cabinet agreed that the current public health measures should remain in place until the 10th of August. We have agreed that the country will now not be progressing to phase 4 of the revised roadmap for reopening society and business. The priority now must be to get that R number back below 1. By doing so, we will give ourselves the best chance possible to fully reopen our schools in late August. It is also a critical step in the process of making sure that essential non-COVID healthcare continues as quickly as possible. With this goal in mind, I would now like to set out 5 steps that the government has decided we must now take to further protect public health. The government agreed today that face coverings should be worn by all customers in shops and shopping centres across the country. Retail staff will also be required to wear a face covering unless there is a partition between them and members of the public, or where there is a distance of 2 metres between them and members of the public. Regulations with details on enforcement and penalties will be formulated in relation to this advice, and the government has accepted in principle NPHET's advice in relation to face coverings. Given the risk of the spread of infection associated with social gatherings, as well as the evidence of outbreaks from bars and pubs in other countries, pubs, bars, hotel bars, nightclubs and casinos will remain closed until the 10th of August. Pubs and bars which are currently operating while serving food can remain open once they are fully compliant with the public health guidance. There is evidence that unrestricted house parties have led to a rise in recent outbreaks of the virus. It is now recommended that social visits to people's homes will be limited to a maximum of 10 visitors from no more than 4 other households. The current restrictions of 50 people at indoor gatherings and 200 people at outdoor gatherings is being extended until the 10th of August. We are continuing to advise against all non-essential foreign travel. The global situation is deteriorating, and there are growing concerns about re-emergence of the virus in Ireland as a result of overseas travel. I and all my colleagues have had a lot of correspondence on this matter, and we're very acutely aware of the anxiety across the country at the prospect of visitors from virus hotspots travelling freely within the country. In response to these very valid concerns, a number of further actions will be taken. The government will publish a green list on Monday the 20th of July. Countries which have a similar risk of infection than Ireland will be included on this list. However, I want to emphasise the fact that we will continue to urge people against unnecessary foreign travel. This list will be kept under fortnightly review. There will be an increased presence of compliance staff and increased communication at our ports and airports to make incoming passengers aware of their obligation to fill out passenger locator forms correctly and their requirement to restrict their movements for 14 days. Work is underway to move the passenger locator form information online so that passenger information is more easily accessible for follow-up checks and calls by an expanded tracing team. In support of all these preventative measures, there will be a renewed communications campaign across all formats and targeting all age groups to ensure the maximum public awareness of these new requirements. In particular, we need to refocus the message for our young people about the positive role they can play in preventing the further spread of the virus. I'm also very conscious of and grateful for the work that has been done to date by our print, broadcast and online media in amplifying important public health messages. I thank them for their ongoing effort in this regard. I understand how difficult the journey so far has been. All of us have had to make changes in our lives, and too many of us have had to deal with the terrible grief of lives cut short. And I know that some of the steps I'm announcing this evening will come as a disappointment to some. But I also know that our people are deeply resilient. I know that we care for our families, we care for our neighbours, and we care for our communities, and we all care deeply for our country. I know that even though this delay in phase 4 of the country's reopening would be disappointing, it will also be understood for what it is: protection of the progress, the undoubted progress we have made to date, and our best approach at further sustainable progress in our education and health sectors in the autumn.
Thank you, Taoiseach. We've come a long way since March. We have stayed the course, we have suppressed the virus, and we have protected our health service. The Irish people have demonstrated solidarity and good faith in each other, and our success is down to this collective effort and everybody's willingness to follow the public health advice. And this hasn't been easy. People have had to make very difficult decisions to stay away from people they love, to cancel holidays abroad that they deserve. Our healthcare workers have gone far above and beyond what could ever have been expected of them. And people working in other sectors have kept going in order to keep us going. Public transport has never stopped. The supermarkets have been well stocked and opened, thanks to the efforts of a huge number of people working in very difficult circumstances. All of this has got us to the point where we have one of the lowest prevalences of COVID-19 in Europe. What we're asking now is that everybody continues to be careful. Our public health advisors, who have led us to where we are now, are telling us we need to remain cautious. As the Taoiseach has said, we're pausing proceeding with phase 4, we're postponing the reopening of the pubs, we're widening the mandatory use of face coverings, we're limiting the number of visitors we can have in our homes. We're staying at the current numbers for outdoor and indoor events. Why? To prevent a resurgence of COVID-19, which so many experts are very worried about, and which they are seeing, and which we're all seeing in other countries. We have to keep this virus suppressed in our own country. We have to protect the most vulnerable in our own country. I know the Irish people will maintain the enormous solidarity that has been shown so far. I want to acknowledge the huge numbers who've downloaded the COVID Tracker app, more than 1.3 million people to date, and the many, many people who as of this week are using face coverings on public transport. Ireland is doing well because of the public health leadership and because every single person in this country has taken the personal responsibility to do the right thing. Our ask now is that we all continue to follow the public health advice. We all continue to take our own responsibility, and together we will continue to suppress this virus. Thank you.
Rona.
Thank you, Taoiseach. Good evening. In the short few months since the first cases of COVID were reported in Ireland, it quickly became necessary to take unprecedented action and to apply public health measures to control the spread of infection. The risk to human health and life caused by COVID-19 prompted swift action by the whole of our society. In a powerful demonstration of solidarity, the people of Ireland adopted new personal and collective behaviours and followed public health advice to protect themselves and others. Together, you have changed the trajectory of this pandemic in Ireland. and many lives have been saved. However, this pandemic is not over. Globally, it is accelerating. And here in Ireland, it remains active in our communities, and it only needs the smallest window of opportunity to become a major problem once again. NPHET has continued to monitor the spread of this disease, both domestically and internationally, since the beginning of this pandemic. In recent days, NPHET has had a growing concern regarding the increase in cases of this disease and the profile of these cases, with an increasing proportion in younger people, a number of which were linked to large clusters. We now believe that the reproductive number has exceeded 1, and our 14-day incidence has risen from a low of 2.5 per 100,000 to 3.9 per 100,000 today. The National Public Health Emergency Team met yesterday and recommended a cautious approach be pursued at this time. This virus is extremely infectious. It wants to spread, but it needs people to come into contact with each other for it to do so. This is why all of the measures that we've been talking about for many months now are so important. Physical distancing, hand hygiene and respiratory etiquette, wearing a face covering where appropriate, avoiding large crowds, and working from home when possible. These are all the actions that each of us can take to cut the chains of transmission and stop this virus in its tracks. As a country, we achieved what seemed impossible in early March. We suppressed the virus in our communities, we reduced the reproductive number to less than 1, and we protected lives. We need to continue to show solidarity with one another, remember what we faced, and now redouble our efforts to continue suppressing COVID-19, thereby protecting our families, our friends, and each other. Thank you.
On Barry Cowan.
We'll just take questions on COVID first. We can deal with questions in relation to political matters after that, but this is essentially about COVID, but I will deal with questions in the aftermath.
Dr. Glynn, are you frustrated at the measures the government have in place at the moment at our ports and airports? Would you like to see mandatory testing brought in and perhaps a red list of countries where we shouldn't be accepting flights for non-essential workers?
So clearly, the more measures that are brought in around any part of this disease, the better from a pure public health perspective. You asked about mandatory testing. That's not something that the National Public Health Emergency Team believe is an additional tool at this point, and it's not something that we've recommended.
I'm just wondering if these measures announced today signal that the acceleration of the roadmap that was announced by the previous administration in its last days in office came too soon. Should they have condensed it at the time, as it were? And also in relation to pubs, the Vintners Federation says this is a hammer blow, particularly to family-run pubs, to small pubs in rural Ireland that they say are far from the crowds that you see images of. So will there be any support measures to help pubs to reopen or to keep their businesses afloat now as a result of these measures?
2 points. To be fair to the last government, it was always made clear that the roadmap were indicative timelines and that there was flexibility would be applied to the reopening of society, and that's what has transpired. And there was also an expectation that once you reopen, there was always the possibility and likelihood of numbers going up. I mean, I think that's fairly obvious, fairly logical. The point is built into the roadmap is the flexibility to pause and display some caution as we monitor the spread of the disease and its continuation, and also as we monitor the international situation as well in terms of the spread of the virus globally. We will be learning on an ongoing basis to live with COVID-19 for a quite considerable length of time to come. And the challenge for us as a society is how we can organise ourselves safely to work, to recreate, and to engage as normally as we can within the context of a very dangerous virus. And I think we have made very significant progress in this country. Numbers are still relatively very low compared to other countries, but we take seriously the advice from NEFIT, and I think it's the right thing to do to press the pause button. I do accept your point that it's very, very difficult and disappointing for publicans in particular. The forthcoming plan and stimulus plan and the continuation of various mechanisms such as the wage subsidy scheme and others hopefully can help to ease some of the pressures. And there will have to be engagement with the industry and the sector as well in terms of their plans for the 10th of August, in terms of reopening then at that stage.
Just two questions. Dr. Glean, could you just explain, I don't understand what the difference is between opening a pub that serves food and a pub that doesn't serve food. Just from a medical point of view, it would seem that if they can social distance safely, that they could perhaps both be open. So could you maybe explain the thinking behind that? And Taoiseach, you're obviously going to be flying yourself this weekend to Brussels on Friday. Are you going to be self-isolating when you come back, or are you doing testing, or how are you managing that own risk yourself?
First of all, in relation to the pubs that serve food, NEFIT's advice has been very clear throughout this, and it was that restaurants should reopen on the 29th of June, and that pubs that reopened at that time should operate as restaurants. And we're very clear again in our guidance that we've and recommendations yesterday that pubs that continue to stay open as restaurants now need to very strictly adhere to the guidance that's there. We are in a good position. So this should not be seen as a very significant setback. It is a pause. Compared to many countries across the world, we are still in a very good position. The challenge for us is to maintain that good position and ensure that all of the good work over many months now is not lost. And the power to do that is at an individual level in all our hands, with all of the measures that we've been advising people to adhere to for many months.
The government approved today, again advice, and have been in discussions with the CMO in relation to travelling to the meeting in Brussels. I think it is essential. It's the first physical meeting of all European leaders in the European Council about a major recovery fund to try and kickstart and underpin economic recovery across Europe, with very significant implications for our country. So the advice will mean a very, very low numbers travelling, very low numbers, myself and perhaps one or two others, that's it. But also, I will have to take special measures. When I come back, I will be tested immediately, and will be tested 7 days after I come back as well. So there's a range of measures specifically to enable me and ministers, when important European Union meetings in particular recommence in a physical way, as the Council meeting is next week.
Taoiseach, the VFI have already called this a hammer blow for rural pubs. People have spoken in the past about potentially regional lockdowns or regional solutions. Is there any has any thought been given to rural-based exceptions or exemptions for pubs?
Not at this stage, but what I would say, I do acknowledge it's a hammer blow for quite a number of for the publicans across the country. I understand that. This is not something we would, ordinarily would like to be announcing, but I think what has stood the country well from the outset of this pandemic has been adherence to the broad principles of public health advice that has come from NEFIT and public health doctors. And I would say that essential principle that all parties in the country have adopted has been the touchstone by which we have progressed our response to this virus. And perhaps, in sharp contrast to some countries around the world who perhaps didn't adhere or align their political decisions to the public health advice they received, I think the results are there. And so the advice from NEFIT was strong. They are worried about the trajectory, and that if we didn't intervene and take these measures, it would take an inevitable course, which is in nobody's interest, not least the publicans, not least the economy. Because remember, what is essential for the economy overall is the suppression of the virus and the continued suppression of the virus. Our key priority above anything is to get schools reopened in September. If we were to allow the current trajectory continue unabated without any interventions, that could potentially put schools in jeopardy. As it is, we're on target to get the schools open, and we're working with the stakeholders. But that is my number one priority, overriding everything else, is to get the schools reopened. And very quickly after that, working with the Minister for Health, is to get services, non-COVID health services, resumed as effectively and as quickly as we possibly can.
Can I just add one point on the pubs? It is undoubtedly a very, very difficult news for publicans across the country. The original plan was that they would open on the 10th of August. So while not to downplay how difficult this news will be for publicans across the country, essentially what we are doing is reverting to what the original date for that was, which was the 10th of August. That may be the case, but the advice was always that it would be looked at by NEFIT ahead of time to see where we were, and in the same way that when things were going well, it was accelerated. NEFIT's advice now is that they're concerned, and so we're reverting on this to what was the original date.
Sorry, just on the issue of the OR number, from the outset of this pandemic, my understanding is that the reproductive rate, a greater weight was put on it from the beginning, and as the sample size goes down, there's been less focus on it. But today, obviously, people will hear alarm bells that the OR number has gone above 1. Is it still the case that it's not weighted as to such a large degree as it was at the beginning of the pandemic back in March? Is that still sort of the case we're working off? Secondly, just on the issue of, I think there's been some sweeping statements about younger people, about clusters, perhaps in congregated settings. Taoiseach, when you were in opposition, you said you wanted greater transparency around clusters, and you thought that perhaps locations should be revealed about where these happened. I suppose now you're in government, and can we get some greater clarity, I suppose, if we're going to have nationwide measures, perhaps people might want to know more specifics about what the backing is for some of these decisions.
Ronan, do you want to take the OR number issue now?
Sure. So you're correct that the numbers, relatively speaking, are low at the moment, and that means that there is some uncertainty around the reproductive number. We would have had far more certainty around it going back 6 weeks, 8 weeks. But that notwithstanding, our best estimate is that even allowing for that uncertainty, we're confident, unfortunately, that OR has risen above 1, and we think it's in the range of somewhere between 1.2 and 1.8. Now, depending on exactly where it is within that range, that will obviously dictate very significantly where we go over the coming few weeks. And clearly, and as we said, when we make these recommendations, we consider a whole range of different factors. It's never just one parameter. So, for example, at the moment, the numbers in hospital, the numbers in intensive care, thankfully, are low and very stable. But there are other factors that fed into these recommendations, such as the increasing number of cases over the past number of days in particular, and as you've said, the profile of some of those cases in terms of the age, the numbers of contacts associated with some of the individual cases, and then clusters as well.
Yeah, and in terms of there has been considerable progress in terms of identifying county by county, for example, the incidents and so on. The testing and tracing is quite substantial at the moment. I think it's up to 46,000 tests in the first week of July, approximately. And the situation in institutional settings and in healthcare settings has improved very significantly as well. But there have been community transmission, and some have hit the airwaves in terms of some locations. That's something we'll continue to work on, and giving as much information as we possibly can in relation to the outbreaks and clusters. And part of that is what we're doing here this evening. It's in response to what has occurred, and in particular the what's termed house parties, large numbers of people in closed settings. That is an emerging problem and an emerging issue. and it's something that we have to highlight and deal with, hence the recommendation in respect of social gatherings in one house. Yeah. In relation, yeah, I did.
With the decision making around perhaps if it happened in a smaller town over by the west, that you wouldn't have to bring in such measures perhaps on the east of the country. Is that not your view at the moment?
No, in terms of transparency, I'm in favour of the maximum transparency. But we have county by county numbers now, and there's no issue around that. We know where the higher prevalence is in Dublin, for example. It continues to be. I think Kildare is next. And so there has been, to be fair, there is a reasonable degree of transparency. My earlier comments were in respect of healthcare settings. If there was an outbreak in a particular home and so on, I believe that should be publicised and people should be made aware of it.
Thank you. Two questions, Dr. Glynn. If you just on the question of clusters, if you might expand a wee bit on the house parties and the travel-related clusters, how big a proportion of the clusters do either of those account for, and are there any clusters related to pubs? And Taoiseach, you referred to an increased presence at the airports in terms of people visiting the country. Should that not go beyond the airports? Is that one of the areas where we've fallen down? So should there not be almost a travel tracing system where there's a physical check-up that people are staying where they're supposed to be staying, on a spot check basis? And is the prospect of testing at airports or beyond the airports similar to your own travel plans next week? Could that be done on a wider basis for other visitors?
You take the first question.
Sure. So on the issue of clusters, so we have seen a large number of clusters. I think to the last question, it's important to state that the vast majority of clusters we're seeing at this point, not surprisingly, are in private homes. That's not necessarily that there's something bad happening in private homes. It's just the nature of this disease that you spend time with your close contacts in private homes and people get it. But we have had a number of clusters, unfortunately, which have been quite large, 40, 50 people, linked to congregation within homes. And so that's one of the reasons for the measures that we've taken today. I guess it's also important in the context of clusters. Clusters are one part of this. There's also what each individual does. And so we have had individual cases with 20 or 30 contacts. Now, thankfully, in the majority of cases, they haven't turned into confirmed case of COVID themselves. But it brings me right back to the key point all along, which is that each of us individually has a role to play in suppressing this disease. Each of us individually should make decisions about the environments that we go into, the environments that we don't go into, and the measures we take when we do go into environments to ensure that we're keeping ourselves and others safe. A key point about this disease, I think, that often gets lost is that we can all be standing here this evening. We can all appear well, have no symptoms, and yet one or a number of us here could have this disease and be spreading it to each other. And that's why even when you're in the company of people you believe to be well, you need to be taking care, you need to be distancing, and where appropriate you need to be wearing face coverings.
Just to say, Stephen, look, next week we'll be doing a comprehensive announcement in relation to travel, and there's work still underway. You will recall last week we published a range of measures that we wanted to work on. For example, the passenger location form going online, electronic format, increased presence at airports, the idea of randomised testing. But these are issues that are being worked through as we speak, but that's in preparation for next week's Cabinet meeting.
Can I just add on foreign travel, because there has been a lot of concern expressed by people around the country about tourists coming in, and particular nationalities like Americans have been the focus of a lot of commentary. The measures we're announcing tonight really are about the domestic situation and what we do to protect each other. And the latest figures are that 9 in every 10 new cases is domestic. So nearly 9 in every 10 cases is being addressed through these measures. The numbers coming in, the number of new cases from foreign travel is relatively small. In the United States, for example, since the beginning of June, the total number of cases identified that are people who have come off flights from the United States is just 4 in 6 weeks. And it's entirely possible that some of that might be Irish citizens living in America coming home. So people are concerned. There has been a lot of focus. I think the numbers hopefully will comfort people that actually there have been just 4 cases from American flights in 6 weeks. It's not to say that we're not looking very seriously at travel next week. We are. But let's remember that 9 in every 10 new cases we can take control of right here ourselves.
Taoiseach, just staying on that issue for a moment, just staying on the travel issue, can you explain why the 14-day quarantine for incoming passengers, be they foreign people coming in from the UK or the US, or once you publish this green list, that is going to encourage Irish people to take foreign trips again, even though you're advising against non-essential travel. So with all of that in mind, and you've both spoken about recognising the concern of the Irish people, why have you not put on a legally enforceable basis this 14-day quarantine? I mean, you're increasing staff to show people the locator forms, but there's plenty of other countries where you're swabbed upon arrival and you're taken to a hotel or another facility for a couple of days until that comes back, and only then can you go out and mingle. Why? What's the advice that you've gotten? Why won't you put that on a legally enforceable basis?
Anything we do has to be doable and enforceable and realistic. And again, the mandatory quarantine sounds simple and sounds fine, but there are huge constraints to doing that. Also, there has to be a balance here. I said earlier that COVID will be with us for quite some time, certainly for the next 12 months. And we are a country that has to get the balance right in terms of connectivity and so on. The approach we're taking on travel is very cautious. We're probably one of the most cautious countries in relation to foreign travel, of most, actually, in terms of the measures we've adopted so far and our continuing advice right now for people not to do non-essential travel. Nice musical interlude from somebody. So, but I think we do accept that there needs to be better follow-up, and measures will be and are being worked on in relation to that and following up on people who come into the country. Although I think it was on prime time, or a show the other evening, where there was kind of extensive interviews with quite a number of passengers coming in from the US, all of whom were aware of what they had to do, all of whom were committed to quarantining and taking the precautions that were advised. So we have to keep the issue in perspective. We are conscious of people's concerns around incoming traffic, but it's worth pointing out that traffic through the main airports is about 91% down on this time last year. But that said, we have to take stronger measures that we accept, and that will be the subject of our announcement next Monday.
Taoiseach, there is a lot of concern today about house parties and that sort of thing, but by keeping pubs closed, are we not forcing people to have house parties?
Well, look, that's an issue I discussed with the CMO. But are we sure that if people were in a pub, they wouldn't have a house party after the pub? I mean, it's a human behaviour issue. I think we're being cautious. NEFIT are being cautious. They're advising, look, let's be honest, the R number has gone up. It's above 1. The numbers are going up, albeit relatively to where we were a month ago. They're still low. But when you see the trajectory going upwards, I think it's the right thing to do, to pause and be cautious. And that's what we're doing here. I understand the argument you are making, but suffice to say that I think these measures are designed to protect people, essentially, and to reduce the overall possibility of community transmission and of people gathering. And when people gather, the more and more gatherings we encourage or facilitate right now, the greater the potential of the spread of the virus.
Can I just confirm with you that Seamus Wolfe has been appointed to the Supreme Court by the Cabinet?
Yes, yeah.
Just on that topic, and just bring you back to 2017, when Leo Varadkar Leo Varadkar's government appointed Mary Whelan to the Court of Appeal. I think you call it a directly political appointment. And I was just wondering, what is the process behind Mr. Wolf's appointment to the Supreme Court? Was it something that was agreed during the government formation talks? Is it something that has happened just in this period? And could you accept that maybe there would be a perception that that would be a directly political appointment as well?
So there's two appointments were sanctioned by the Cabinet, one to the Supreme Court and one to the Circuit Court. The Supreme Court appointment was completely independent of any government formation talks, had nothing to do with government formation talks whatsoever, and was not discussed in terms of the discussions. It was a JAB recommendation from the Judicial Appointments Board, recommended the appointment. And my understanding is that that meeting was held prior to the formation of the government. The recommendation has come through now. So, no, I can't accept that when it's not. I have to give you the reality of what happened. You know, the facts. Those are the facts. A JAB, a Judicial Appointment Board appointment is that. I can't interfere in that. Nor would I attempt to. And it was a JAB recommendation. And that's my understanding of it, and the recommendation came today to Cabinet, and the Cabinet agreed it, along with an appointment to the Circuit Court as well.
Have you had any contact with Garda headquarters yourself about it, Drew Harris, after claims were made about your former minister now, about members of the force?
No, absolutely not.